Hi, good afternoon. This is Marx, and I'm thrilled to be with you today in this live webinar, along with one of my good friends and industry giants, Scott Becker. And this is part of our leadership series. And we had our first live webcast a couple weeks ago, our inaugural one. And now we're here with Scott. I'm super excited, and I know you are as well, and why you're joining us. And I'm just so excited. Remember, this is interactive. The reason we do this live is to get interaction. So there is the ability to enter in questions, and as the dialogue proceeds, we will completely go off script and answer your questions because that's the way we roll. We just want to be very responsive to what you want to hear. And I think Scott is really one of the most fascinating people that I've met. It's just amazing, his background. I'm going to let him introduce himself. One of the things I appreciate so many things about Scott, but one thing is that he's helping my running game. So I tend to run a lot, and I listen to his podcast all the time while I run. Like this morning, I was listening to the physician from Scripps. I'm blanking on his name, the cardiologist, Eric Topol. And it was a fascinating interview. And then that naturally rolled into the next one. And there's no advertisements, which I love. So you just get like pure content. But anyways, I want to welcome Scott. Thank you so much for joining us. And let me just kick off with a couple of questions about introducing yourself, who you are, and I'll dig a little deeper. So I'm just going to leave it right there. Just tell us a little bit about yourself, but I'm going to dig in a little deeper.
Sure. Well, Ed, thank you for having me. What a great pleasure. So by background, just very simplistically, a couple of highlights. You asked me personal, professional, close family. And then professionally, we've got graduate from Harvard Law School. The highlight of my Harvard Law career was I had the chance to be a teaching leader for President Obama was in a class that I taught, which was crazy because he was a million times smarter than I was. It was actually a fascinating experience. And I could talk more about that at some point, but fascinating. I've had a chance professionally to straddle two careers. I've been a lawyer and then started a media company focused in healthcare, literally now about 28 years ago. And that sort of lives in four areas: hospitals and health systems, health IT, surgery centers, which was the original founding 28 years ago, and then spine and orthopedics. And the large focuses are hospitals and health systems and health IT. And it gives me a wonderful chance to connect with just a great array of people of all types. Just a great pleasure.
Yeah, so it's fascinating. You've been at the same firm for over 30 years. And like you said, you've done some teaching, the law practice, but also this whole Becker's consortium, if you will, for lack of a better term. I mean, people know you not only as a great attorney, but the podcast that I mentioned, your own webinars, your own, I don't know how many there are. There are tons of, you're very omni-channel in terms of Becker's, plus the conferences, which are fabulous. Tell us about how long that's been going on, the genesis. How did you think about that and launch it? It's just fascinating how you started from zero and grew that whole omni-channel presence.
Sure. So we started it literally 25, 30 years ago. I mean, and it started as sort of a passion fun. I was a young lawyer developing a reputation in the surgery center area, and that's sort of how it started. And I sort of, messed around with it for 10, 15 years. Then at some point, I started hiring people, and meaning full time. Until about 15 years ago, we outsourced everything. About 15 years ago, I started hiring people full time. And the great lesson in life, every life, is that nothing is done great without teams. So we were sort of a very small little media company. We started to hire people. Some of those people ended up being magnificent leaders. One of them came out of college, was working with me in her dorm room or apartment in college. She now, 15 years later, is the CEO and one of my partners in the business, and a magnificent leader. But we grew, a conference leadership team, an editorial leadership team, a management team, of managing key accounts team, and a whole group of things. And we're really, we're really in three areas in terms of modes: print, digital, and events. Events are 40, 50% of our business, so it's sort of a challenging year in the event space. But the digital part of our business, which is white papers, webinars, online, we've got about 15 different daily newsletters. We have about 24 full-time writers. It's a big, big part of the business. And it really grew when I started hiring people, and some of those people ended up being just magnificent leaders, and they really took it to a whole different level than I could have ever thought of. But it was really that leadership that came from editorial leadership, which some of those people. Jessica Cole is our CEO. They just really were able to sort of envision it. I had a very good focus, and they envisioned it and grew it in a way that I could never have done. And that's really what it became. It's a very cottage sort of business, and grew into sort of the one or two top media outlets for business-to-business healthcare in the healthcare world.
Yeah, it's an amazing growth and amazing journey. And what I really appreciated, I know my colleagues do as well, what differentiates it from some others is that you're drawing the whole C-suite. And it's not just IT, it's not a bunch of CIOs, which is great. It's not a bunch of CFOs that the HFMA might cover, but it's really this whole cross-section. And I've been personally on panels where I've had a CEO there, a CFO. I know that some of the seminars or conferences are specific to some of those genres, but by and large, it's really about the leadership of healthcare, and I think it's a great platform that you all have developed. And I know that.
Thank you.
Yeah, I know that.
Go ahead. I'm
many
sorry.
of my colleagues really gain a lot from it. Go ahead.
No, we love it. We were very focused originally on specific titles and people in leadership. So whether it's CEOs, CFOs, CIOs, at this point it's gone deeper. Leaders on the clinical side as well. We really set out to be sort of what we thought of totally nonpartisan and totally sort of the Wall Street Journal of healthcare, meaning the place where we can get concise business news. Here's what's going on. We knew from the get-go we couldn't be great at being, for example, peer-reviewed healthcare journals. We couldn't be great. There's people that are far better than us at that. We couldn't be great. We could be good in print, but we never wanted to compete with Modern Healthcare, which is sort of the leader in print. It just wasn't the business we wanted to be in. We sort of really got our growth going at the time that digital took off, and so we were leaders in digital, and still have, our goal is to have the most needed meetings in the business and the most needed websites and digital in the business. And that's really been our core for a long time. We a long time ago went hardcore, and we'll get more into the substance of what's going on in healthcare today in a moment, and I don't want to bore people with this, but we got very clear very early on the way to reach people was concise, short content. We weren't trying to be a place where you went for the deepest research on how you do a certain type of cardiology procedure or something like that. What we did want to be is, where could you go quickly to get information on what is going on in our sector? What do you need to know? And that's what it took a while to get our editorial team all on the same page, that the goal was concise and short so people can get their hands on what's going on in the business.
Yeah, it's an amazing lessons that you've just actually shared right there. We could spend the whole time going on just how, as a leader, you sort of saw the future, you moved towards the future, and I think that's one of the things that's happening now on a hyper scale with, as a result of the pandemic, is the virtualization or digitization of healthcare is finally happening, and it took a catalyst like that. But you saw the move far ahead of time. We could spend a lot of time on that. But based on this vast experience that you have, I want to ask you a couple questions. So we're sort of pivoting. So we sort of started out about who is Scott Becker and all the great things that Becker's has done and the value add to healthcare around the globe. And based on all that experiences, you talk to people that podcast comes out probably every other day. You're talking to people all the time, and you're hearing what's going on. You've got relationships with all the CEOs, and as you mentioned, on the clinical side as well. What are some of the mega trends? So obviously COVID, mega trend, everyone's really focused on that. But in addition to that, what are some other mega trends that you're seeing, some of the more, so for our listeners, for people who are interacting with us, would benefit everyone to really think about, because maybe we're not thinking about. So what are some of these mega trends that you're seeing out there?
Sure. So I'll start with sort of what I see as the core of what is going on and what we see. And we do have the chance to speak to hospital leadership every single day at multiple different levels. From Chief Quality Officer the other day at Indiana University Health System, to talking to Howard Kern, the CEO of a Virginia-based system, to talking a couple of days to one of the leaders of the New York systems. And so you get a chance every day to see what's going on in the country. And so I'll give sort of like 6 or 7 quick highlights. First is, we've got about 2 to 6 more weeks of, tremendous stress on the system, just tremendous stress in the system. Then you'll have a period of time where I believe healthcare leadership, healthcare systems, providers will need to sort of decompress and regroup a little bit, sort of just get a chance to breathe a little bit. Then after that, you'll start to see sort of normalcy start to slowly ramp up in healthcare systems throughout the country and provider offices throughout the country. And provider and practice offices are different than health system offices at the present moment, particularly depending on what they do, because many of those have been almost entirely shut down. But you'll see sort of a slow ramp up, and that won't really start. You'll need 2 to 6 more weeks of just tremendous stress in the system where people sort of play through the first surge of coronavirus. Then you'll see sort of everybody's going to need a little time in health system leadership, particularly places where it's been hit harder, to regroup. Even the places that have not been hit as hard, it may not be hit as hard, we're not really sure, will end up in a spot where they need to figure out to ramp that down all the planning and prep they've done to go back to normal business. Throughout the country, all elective, all non-essential stuff has been stopped for the time being because of the need to use the ventilators, the PPE, and not wear out the healthcare workforce. That'll have to ramp back up, and that's important to hospital and health systems of every size. A couple of sort of trends that we see before this happened, for those of us that live in healthcare, which many of you do, and Ed, you've lived almost your entire career in healthcare now, we know that there were tremendous shortages of doctors, healthcare workers, and providers prior to this pandemic. This pandemic has shed a bright, bright light on it. And those shortages are across the board. They're in specialties. We all know in healthcare, to get the right specialist at the right time, you almost need special access to that. And that was before this whole thing happened. So this will shine a bright light, I hope, on shortages of providers, and that was already a huge arising problem before this. A fifth concept that we'll see, and again, completely nonpartisan, there's no way you won't see a little bit more movement towards at least public option type discussion, towards Medicare for all type discussions. It's almost inevitable. Whenever you end up with larger swaths of people out of the workforce, they're looking for where is their health care going to come from. And everybody traditionally, not everybody, but a good percentage of Americans traditionally got it through commercial insurance through their employers. Getting commercial insurance through your employers, if you're not employed, is impossible or crazily expensive. And so you'll see more of this discussion. It's interesting to see right at the time where Bernie Sanders drops out of the race, some of his core principles are going to gain more discussion, is my perception going forward. A couple other points. Strong systems will survive this, and those will most likely be stronger in the future. You saw this acceleration over the last 10 years of a movement towards larger and larger systems. And then you saw sort of it slow down a little bit. Still growth of great large systems, magnificent systems, but also lots of community hospitals, lots of other things. And the closing of those started to slow just a little bit. This type of event shows great fragility in small businesses, small systems, small hospitals, every kind of provider. And it almost becomes, as you see a pandemic like this, those large systems do become more and more too big to fail. It would become clearer and clearer in our country. We can't afford to not have enough capacity for whatever problem comes up. In terms of the overall nation, obviously Kaiser a few years ago moved quickly towards digital health. They've been way out in front of it. They were able to do so because they're a fully insured model. Cleveland Clinic, your alma mater, had also done a lot of movement towards it and had really started to pick up steam in it. Now, of course, the world has changed. Everybody prefers telehealth. There are providers that wouldn't see your kids, your family, your anybody from telehealth before who now are thrilled to. And that will, I think, become a little bit more permanent just because people prefer it, like everything else. So we touched on 5 to 7 what we see as sort of key trends and where things are going, and let me turn it back to you, Ed.
No, that's fabulous content right there. I mean, I wrote those down for myself actually, and I think there's a lot of wisdom there, and I think each one needs to be taken. If I were in leadership of a health system, a hospital, even a practice, to your point, is like, how are we going to respond? How are we going to respond to the shortage? How are we going to respond, obviously to digital health? And again, a reminder to our audience, if you have any questions, use the question feature, and we'll be sure to try to pick up the majority of questions. let's talk about one of the areas that you mentioned, just because it happens to be a personal passion of mine as well. And I do think it's going to really, and I alluded to that already, it's on steroids now, is the whole digital health. What sort of capabilities would you recommend a typical, and I know not everyone listening is from a big health system, so let's just assume the average sort of C-suite leader listening, what should they be doing when it comes to virtual health? What would you recommend?
Well, no, it's a great question, and of course, I'm not an expert in technically how to do it at all. What I have had the benefit of over the last few years is doing lots of discussions, webinars, podcasts with people that are doing it. And so there's the technical equipment issues, which in some ways are more difficult within the walls of a hospital because of connectivity than they are outside of it. You know, it's fascinating. When we do this webinar today, just a few years ago, before the iPad became so prevalent, go to webinar, Zoom, you know, the iPhone, we couldn't do this and have a seamless discussion like you can today. It's not perfect, but it's magnificent compared to some time ago. What's happened in the health systems, and this is true of everything in the world, is those systems that had built their telehealth capacity before. If you look at systems like Cleveland Clinic, Jefferson Health, Kaiser, and even the great companies in telehealth, those that were ahead of this just a few years, just a little bit, are now positioned to make almost seamless explosion of use compared to where they were a few years ago. I mean, you look at platforms that were built before. Zoom's a fascinating example. It was built with the concept they had 10 million users last year. This year they're at 200 million right now, which is just a crazy growth. But and they've got imperfections, and they've been well publicized. But the point that they had built the platform before and tested it left them ready for a moment in time like this. You know, and so I don't know the technical aspects. I do know everybody's talked in the last couple of years about the movement towards digital. This will force those that weren't there to really have to up their game. It will put those that are already invested in it in a spot where they can learn and adjust from where they're at and really, really take advantage of this moment in time in terms of doing great service for their communities, their people, and physicians, of course, who couldn't get reimbursed by Medicare or payers for this before, are generally thrilled for this period of time during emergency to get paid for it. And it'll be fascinating to see if that gets rolled back or not.
Yeah, I agree with you. Yeah, and I'm hopeful, as I know many are, that we don't give back any ground that we've gained as a result of this unfortunate situation. But I'm a big believer, like you, that moving to digital is better for patient care and can help save people's lives. So we talked a little bit. We spent the last 10 minutes or so, Scott, talking about some things related specifically to the pandemic, some trends, and those were just fabulous 7 or 8 points that people can take. Let's switch now a little bit to more global, or more specifically on leadership. And again, I've been to your conferences, and not only do you have great healthcare content and leadership content, but you also bring in a lot of fabulous speakers from the sports world, from political arena. You've met all these people. So what are some of the best leadership gems that you've picked up on, and maybe someone that you admire or someone that maybe surprised you? And it'd be sort of interesting to hear your perspective and what sort of leadership, again, what sort of leadership gem maybe did they impart to you and to your audience?
Sure. So I'll talk first about people in healthcare, and then some of the celebrities we've met and some that have surprised me and so forth. The thing that I found fascinating, it was probably about 15 years ago when my world pivoted out of healthcare generally and more fully into hospitals and health systems. And prior to 15, 20 years ago, so much of my work was with physicians and communities that at that point in time, if you went back 15, 20 years ago, sort of had a fairly negative view of the hospital CEO. It used to sort of be an us versus them in the hospital CEO. So sort of the most surprising thing to me is I got fully into healthcare 15, 20 years ago. I shouldn't say, is I got fully into hospitals and health systems. Until about 15, 20 years ago, more of my work was with surgery centers and surgeons, was the crazy levels of competence and compassion amongst healthcare leaders. Like, if you had listened only to a certain sort of like echo chamber, you would not have understood the greatness in the level of sort of compassion, to go with competence, of the major healthcare leaders. And what's fascinating to me is this very compassionate group is very, very broad range of political views, but fascinating on whoever is in power, they often orientate a little bit away from it for various different reasons. And that's the fascinating thing that I've watched, just fascinating sort of compassion and competence. Some of the great leaders that I've had a chance to visit with over the time in the healthcare world, and there's so many of them, so I hate to leave people out, but there's people like, Bernard Tyson, who passed away last year from Kaiser Permanente, just a amazingly interesting leader who had a different vision than many others. You've worked a lot, obviously, with Dr. Cosgrove. I don't know Toby anywhere near how you do, but a fascinating leader that came as a physician into leadership. There's a couple of nurse leaders originally that became major CEOs, people like Nancy Agee and Jenny Spiso. People like that, the amazing thing about them is they bring this very clear patient care and quality perspective to everything they do, and it transcends their systems. It's a fascinating thing. There's other people like Dean, Stephen Klasko, fascinating personality, but saw digital, invested in it so heavily way before everybody else did, and it's left Jefferson Health. Jefferson Health, if you would have told me Jefferson Health would now be a top 15 U.S. News and World Report sort of health system, if you would have told me that 10 years ago, I would have thought you were crazy. And they've really developed into one of the great systems in the world. There's people like Gene Woods, Chris Van Gorder, just to name a few, and I hate to leave people out, but there's so many. There's Mike Dowling, who's led up so much of the New York efforts, and this fascinating mix of magnificent personal skills with great analytical and competent skills. And there's a lot of that. Then there's smaller health system CEOs, the Osner gentleman, Warner Thomas. There's John Corus of Tampa. There's just so many great health system leaders that are just, it's a fascinating mix of this. What I see over and over again is this magnificent mix of compassion and competence. They really care about their communities, and they're very open about, look, we are cross-subsidizing. Yes, we are taking from the wealthy to make sure we can take care of the poor communities. I mean, it's a fascinating understanding of the game and the business that they're playing, but the fascinating level of compassion and the caring for their poor communities as well as taking care of their wealthier communities in a great way. So just fascinating leadership throughout the healthcare community. Much, it gets negatively talked about by people outside the industry until you understand and see what these people are doing. The level of labor intensiveness of healthcare to go with technology. It's something to be admired versus thought negatively about. And you see it more today as people sort of respect the healthcare workforce again and leadership again. But we've had that front row seat for 17 years, and that's sort of surprising. This just tremendous level of competence and compassion amongst our healthcare leadership. And so that's sort of from a healthcare leadership standpoint. From a celebrity standpoint, there's so many that have surprised me. And tell me if you want me to touch on that for a second.
Yeah. Please, give us one or two that really surprised
Sure.
you.
So I talk about, so I've known President Obama for a long time. He was a student in the class of mine. He used to explain to me in class, and he was a student, he would say, I think this is what Scott is trying to say. Like that was a normal way of conducting the class. And you have to understand, President Obama, and I'm a centrist, I would present myself as, was so much smarter than I was. He would sort of, and he was so gracious. He and one other kid in the class, at that time kids, would explain things in such a way that was so much better than I could do so. It was like almost like a Saturday Night Live skit, how they would explain, but they would do it so graciously that didn't leave me. I was like, yes, that's right. But just amazing intelligence. The other bill that surprised me. I mean, obviously I've got to know George Bush well, and there's probably no nicer person than President Bush. And I don't know that I would have expected, not expected it, but just a wonderful, wonderful person. Hillary Clinton is someone as a centrist, we always had a confused view of. And the more you get to know Hillary Clinton, the more she's about the most gracious, nicest person you'd ever meet. And so, if you meet her in person, and I've met her now several times in person, there is no person that is a nicer person, and she doesn't come across that way on TV. The other person I put in the same category, we've had Tucker Carlson speak at our meetings for a long time, and Tucker Carlson, he's now in this weird position TV-wise where he's got to take the point on Fox. So he's become, you hear him talking in a certain way, but he's another person. When you hear him talk in a smaller audience, hear him talking in person, his views are much more moderated. They're very socially progressive on some issues, and you would never in a million years believe it in watching him on TV. But just an absolute, like him and Hillary, who are polar opposites in terms of our political landscape and how they're viewed in person, are just a pleasure. Incredible pleasure. And Bill, I don't find quite as much as a pleasure in person as I do Hillary. A couple of sports people. We've had Kareem Abdul-Jabbar a few times, about his son is a spine surgeon, and about as bright and thoughtful person as you'll ever meet. And then there's other people that we respect immensely that I wouldn't have thought I would for other reasons. I mean, there's people like that have been able to transition their professional careers in different ways. There's people like Joe Theismann and Lou Holtz that are sort of sports people, but they've worked hard to make transitions in their life. And I think it's fascinating to watch people like that. I respect it greatly, as all of us go through multiple iterations in our own professional life, watching them sort of go from, football player to broadcaster to public speaker to whatever they do. But the grit and grind and skill to make those transitions not easy. So a lot of different people that I've been impressed with that have surprised me as being just a complete pleasure where I might not have expected it.
No, that's good insights, and it's always interesting to hear what sort of differentiates some of these leaders that have come from other industries. So that's really good. And just a quick point on the compassion piece, because some people ask, well, how do you gain compassion? Because is it just you born with it? Do you how do you get it? And I always tell people a couple things. I say one thing is volunteer. So it could be at your local shelter, it could be in your hospital, but volunteer and get exposure to people that may not have the same benefits that you do. And you'll start to generate compassion and learn to have more full appreciation. The other thing is anyone can work. Most of us, our audience, you can work part-time for free within your hospital health system in a variety of different roles. And that also gets you exposure to what it's like for your patients, what it's like for some of your team and other people in different verticals in your hospital or health system. But all that kind of gives you exposure to other people that may be less fortunate than you or in a difficult time of your life, and helps develop that compassion. Because I think you're right, that's a key feature of some of the great leaders that you just highlighted. We're down to one last question, and I'm looking at some of the audience inputs and other inputs. Let me give you a tough question here, because you mentioned presidents already. You went through the last 5 presidents. What would your advice be, Scott, from a healthcare point of view, to President Trump, based on everything that you know and you see, with healthcare? So it could be specific to the pandemic, it could be specific to healthcare in general. But what would you, if you were his number 2 person giving him advice, what would it be?
Sure. Well, I think being his number 2 person is a tough job. But aside from that, let me say, here's the 5 or 6 things I think you need to do, that he needs to do, and I think they're trying ferociously hard to do them, and sometimes can't get out of his own way in terms of how he speaks to others and gets in these issues and attacks and so forth. But there's 5 or 6 things. You obviously need a ton of personal protective equipment and a ton of ventilators. You just need to have those things, because you can't play offense against this virus in any way, shape, or form if we know that too many people can get infected and overload our system. I mean, none of us want to be in a spot like they were in Italy, where there's just not enough ventilators to go around for a period of time. So you need to sort of shore those up, and unfortunately it takes time to shore those up, and they're working at that. So, but you need enough of that. You if not, you're stuck playing complete defense, which is the place we're in as a country now, and that's not a fault issue, but you need enough PPE and ventilators. Then you need enough testing. You just need enough testing to be able to really understand why and what's going on in our system. Where are people that have been sick, who's got maybe some antibody immunity, what are real death rate and infection rates. You just need information. If you don't have enough information, you're playing defense, because you got to take the lowest risk approach, which is we all stay home. So you need sort of PPE, ventilators, and abundant testing. And it's the more that I learn, it's not that they've done a great job or a horrible job, but the more I learn and why I understand, so all of us understand. We go to the doctor's office, we get a flu test, it takes 15 minutes, and we sort of know, do we like it with the flu or not? Then they confirm it over a couple of days. And so I ask people, chief medical officers, why are we having trouble with this testing? Why is it taking so long? And you get a lot of good answers as to why, yes, we tested more people than anybody else in the world, but per capita, we're behind on testing. But you get answers that make sense to me. It resonates to me why it's not rolled out as quickly as we'd like it to. And they're making progress. But we need, obviously, information allows us to take better assessments of risk versus we also stay home. So you need abundant testing to get information, and huge priority on PPE, ventilators, testing. Then you have to really understand death rates and infection to death rates and mortality death rates. It's an information thing. If we understand that the real infection to death rate is 4%, well, unfortunately, we're all home for another year until they get vaccine. You follow me? If you understand that the real infected death rate is 0.05%, I mean half of 1%, excuse my fractional math, you have a very different discussion because you know, look, this is 4 to 5 times more deadly than the flu, but the flu killed 80,000 people just 2 years ago. And yes, we have to play defense, but we could open up our economy again and do things. But you need information, and you need to understand these death rates to make intelligent choices. If not, this has become so politicized on both sides. You know, one side saying we care about people, one side saying and it's not that they're saying that, but one side being, the narrative being we care about people, the other side narrative being we care about the economy. And the reality is without good information, you can't make good choices. So PPE, ventilators, testing, understanding death rates, then obviously we have to keep on prioritizing vaccines and medicines, but we need to be able to live and run a society, even if those don't come out as well as we'd like them to. Even with the flu vaccine, it works for half the population, maybe, but you sort of have to get there. It's those 5 things, and then you do have to spend a lot of time in the context of these 5 things, just thinking, how do you start to ramp the country back up? What are the prophylactic steps? I mean, we're all, everybody on the phone, everybody in the webinar is fairly bright. And at the end of the day, I might have categorized this a certain way, but everybody, you know, you hear people on the left and right starting to come to the same conclusion. We sort of need these things. And the president's team, they're not dumb. I think they start to get that they need these things. I mean, they're not stupid people. You got a lot of bright people around, you know, and it's a process in a country with 330 million people. You know, one of the things I look at when I look at countries like China and India that have a billion people, I don't even know how you ever take care of the healthcare community and poverty needs of a country with a billion people. I just don't know how you possibly get there, particularly in a top-down economic system, but even in a capitalist system, which India is closer to than China, it's just brutal. So, I mean, people need to sort of like, when people take shots at our healthcare system, it is imperfect, but it's pretty good that we're taking care of 330 million people, far better than any large country in the world does. And that's not an argument that there doesn't need vast improvement, and we don't need a public option, we might need Medicare for all. It's not an argument that we don't. I just give our healthcare system overall an amazing task that they're charged with, and overall the healthcare system and our leaders and healthcare workers do an amazing job of it.
Yeah, no, that's great insights, and I think a lot of what you said also applies. And the reason I asked that sort of broad question, we can take that very personally too as leaders in our own organizations. Are we up to speed with analytics? Are we up to speed with digital? Are we up to speed with our supply chain? A lot of things we can't control. You know, it's more on a much more global level, but some things we can, and I think you just highlighted a few of them. Scott, I know we're out of time. Scott, thank you so much. You're an amazing person. You're one of the good people doing good work for our country and our world, helping propagate good information to others, making it easy to digest. So I'm honored that you would spend time with us. So thank you. 10-second commercial of some upcoming webinars. Digital Unplugged series continues. The 3rd part is coming up. We're actually going to share a model for digital transformation that anyone can have. We don't own it. We created it, but we're giving it away because we believe it'll help other people. You can take that model and change it to fit your organization. It's cool. And then we have a virtual care series coming up. Dr. Toby Cosgrove will be with us, Russ Branzel from Chime, and then in the follow-on session will be Dr. Ram Raju, formerly of Cook County CEO Medical Center, and then New York City Health and Hospitals, where I worked for him, and now at Northwell. So thank you, everyone. Again, thank you, Scott. Take care.
Thank you very much.